So my name is Pundrique Sharma, and I'm a consultant plastic surgeon in Merseyside in the Northwest. So breast augmentation is probably one of the most common plastic surgical procedures performed throughout the world, and it's been done since the 1960s. And generally speaking, when we think of breast augmentation, we think about silicone implants that you will have seen on television and Instagram and Facebook. They're by far and away the commonest way to increase the volume of the breast. And that's really what you're trying to do. Breast augmentation is a procedure to increase the volume of the breast. It doesn't improve sag. It doesn't change other qualities of the breast. What it does is increase the volume. Now, there are a couple of other ways to do that. So one way is to do fat transfer. You can take fat from one part of the body through liposuction and transfer it to the breasts. And I think that was much maligned for a long period of time, and there were a lot of concerns about it. I think the jury's out on that now, and it's generally considered relatively, or rather the jury's in on that now, and it's considered relatively safe to do. It has a massive advantage that it's your own tissue and it's not some other tissue, but the disadvantage that there's only a limited volume that you can put in a given time, and so very often it's multiple operations. And for that reason, I think the vast majority of patients veer towards breast augmentation with a silicone implant. The third option I mentioned for the sake of completeness is what we call free tissue transfer. This is something that we tend to do with patients who have breast cancer, for example, where we take, for example, tissue from the abdomen and move it whole, lock, stock and barrel to the breast to provide volume. But it's really not something that we tend to do for cosmetic breast augmentation. That may change in the future, but not currently. So what factors should you consider before undergoing breast augmentation? The other part of the question is, what is the procedure right for everyone? Let's reverse it. Let's ask, is the procedure right for everyone? Well, we have to ask what the procedure is doing. The procedure is basically very specifically increasing the volume of the breasts. It's not addressing sag, for example. So you have to be sure about actually what your expectation and what your aim is, okay? Because if it is, for example, as I say, to lift the breast, breast augmentation alone is just not going to succeed with that. But let's say that your primary aim is to increase the volume of the breasts. And what factors should you consider before having that augmentation? Primarily, it's a risk-benefit thing. Okay, so firstly, is the augmentation the right operation for you, or should you be, for example, having fat transfer? And that goes back to assessing the risks of one versus the risks of the other, and the benefits of one versus the benefits of the other. And that's something that your surgeon should guide you through. You also want to think about the types of implants and the type of look that you're going for afterwards. And I think a good way to do that is, I think it's useful if patients can bring photographs in to say, this is kind of what my expectation is. Then the surgeon can hopefully show you pictures of their outcomes, and you can sort of come to an understanding of what you're aiming for together. I think those are the primary things. And the other thing is to look at the internet for sources of information. And I think probably the most useful source of information is on the BAPRAS, BAPRAS website. So it's the Plastic Surgery Society's website. So it's bapras.org.uk, and they have a patient information section with leaflets specifically on breast augmentation and breast enlargement. So there are two basic groups of breast augmentation surgery. The vast majority is going to be silicone implant based, breast implant based, and the smaller group is going to be from fat transfer. So we talk about the silicone implant based group. There are there are huge numbers of risks to any operation. Standard risks, the anesthetic, getting blood clots in the legs and lungs, and so forth. But there's some very specific risks. I think we've mentioned before the risk of the fact, it's almost a certainty that you will need further surgery in the future. That's a very important thing to consider. It's a decision that you take for the rest of your life that will have implications when you're older. But there are other general risks for breast augmentation. So developing a scar around the implant called a capsule, they become very tight and uncomfortable, and that you might need changed down the line. There is also, I suppose, my biggest worry, the biggest worry that I have is about satisfaction. Is the patient going to be happy with the result afterwards, or are they not? That's, for me, the biggest risk. And that is very much something you mitigate by having a conversation beforehand. It's about expectation, right? The way to mitigate that is to express to the patient what can be achieved, see what the patient wants to do, and see how the two match up. That is probably the most important way to minimize the risks. Now, there will be other ways to minimize risks post-operatively, like wearing a bra, good care of the scar, making sure you move around so you don't get blood clots in the legs and lungs. But your surgeon will generally go through that with you. Okay. So we've talked about the risks associated with breast augmentation using silicone implants. But the other way to do breast augmentation is with fat transfer. Now, the primary advantage of fat transfer is that it is your own tissue, so you're not carrying something that is a foreign material within you for the rest of your life. The disadvantages are, firstly, probably the biggest disadvantage and the biggest risk is there's only a certain amount of tissue that you can transfer in any given sitting. So to get anywhere near the volumes that you can get with some augmentations, you need to have multiple operations. And I think that's a big downside to it. Fat will also change with the rest of your body. That's both an advantage and a disadvantage. So as you gain and lose weight, so will fat transfer. Not exactly the same, but there is a correlation with how that will happen. So if you lose weight, some of that weight from your breasts will also go. Okay. It also carries certain rarer risks. So, for example, there's a theoretical possibility of fat getting into the bloodstream and causing problems in the lungs. That can be very serious if it occurs, but it is relatively rare. It's something called a fat embolism. And that's in addition to, of course, all the other risks that are common to most surgical and cosmetic surgical procedures, the anesthetic and wound healing problems and so forth. Okay. Now, how do you minimize those risks? Well, there's no specific way to minimize the surgical risks beyond, for example, wearing a supportive bra and so forth afterwards, and taking the advice of your surgeon. But again, as with breast augmentation, I think the biggest risk is the risk of disappointment, of expectations not being met. So having comparable expectations, talking with your surgeon, and knowing what is likely to be the outcome or the range of outcomes is probably the most important way to minimize the risks, these honest conversations. Probably the most important thing you can do after breast enlargement surgery to protect your breasts, your new breasts, is wearing a bra. So I would recommend wearing a supportive bra. Usually for 6 weeks, all the time, at least. Okay, that's the primary thing. Other things are very difficult to do to protect the breasts. So we often give antibiotics, which can help reduce the risks of infection. Wound care and taking care of making sure you shower afterwards is actually, I think, very important, is that I think reduces the bacterial burden. And I'll usually ask patients to shower the day after surgery. There are some general things that I think are very good as well. And it's not just about the breast that you want to take care of, but also about your health. So eating properly, making sure you have help around the house at home, that's really important. And also moving around, not You want to be running or doing exercise, but any significant exercise, but you do want to be walking around and not just being in bed, because you put yourself at risk, for example, of deep vein thrombosis and pulmonary embolism, which are potentially very serious complications. And I think also feeling free to contact the hospital, the surgeon, the medical team that's treated you. That's, you know, if you feel that you have a problem, like trying to nip it in the bud is very important. So I guess it would be the thing that I'd probably say to most patients who have any cosmetic procedure is be sure you really want it. You know, that I think there's a lot of pressure on the internet and elsewhere to look a certain way and for an idealized body that's sometimes just not realistically achievable. And there's a cost, financial and otherwise, to having any surgery. So I think the most important thing to consider is the risks against the benefits. Is this definitely the right thing for you? And is there something better that you could do with that money? That's honestly what I would tell the patient. I think that's what they should consider.